I'm Amanda Olson from IntimateRose.com, and I'm a physical therapist certified in pelvic floor rehabilitation. And I'm going to discuss the patient populations that I see that I'm recommending vaginal weights to, because I'm having really wonderful benefits with certain patient populations in terms of strengthening and building proprioception and retraining pelvic floor muscles. And perhaps you're a physical therapist that has been recommending vaginal weights steadily to your patients, and you've fallen into a rhythm where you're recommending them for certain impairments. And perhaps you are a therapist who hasn't touched vaginal weights since pelvic health level 1. So perhaps this will bring up some ideas for you to use in the clinic to help some patient populations that could improve faster, or just have a different training regimen. We know that the literature can apply to certain patient populations and not apply to others. And that's what makes us such skilled clinicians, is that we are able to look at the person in front of us and know what's best for them. So the vaginal weights were originally developed by Plevnik for use of proprioception building in the pelvic floor. The very nature of having an object in the vagina is going to improve the brain's awareness of where that pelvic floor is. So for my patients that have had nerve trauma that's healed either from pregnancy or delivery, or certain gynecological surgeries, or maybe they're just motorically challenged and they have poor kinesthetic awareness, having that weight, even a really low weight in there, is tremendously helpful, because a lot of those folks are doing Kegels wrong, and we cue them in clinic using vaginal or visual cueing or tactile cueing, or I'm lucky enough to have a ultrasound device so I can actually show them where their pelvic floor is and they can see it on the screen. Or perhaps you're trying biofeedback, but then they get home and everything that you've taught them kind of goes out the window because those cues are no longer there and they haven't been able to internalize it. So that is where being able to have the weights at home, insert into the vagina, and they're able to find it. So really wonderful results there. The second patient population is just the people with low tone, the people that are really weak. I generally train them how to do a proper Kegel first without resistance, usually in supine, and then building up into sitting. And then once they have a pelvic floor strength of about 3 out of 5, I'll introduce the weights to them if it's indicated. Counterindications are going to be the people that have excessive dryness or vaginal atrophy, those kinds of things. But for the rest of them, they tend to enjoy them and progress a little bit more steadily at that point. The third population that I'm using them with is athletes, and these could be female athletes over the age of 18 that may not necessarily have had children, but they are experiencing incontinence or prolapse because they are participating in sports that require a lot of heavy exertion, whether it's gymnasts or jumpers, who are having ground reaction forces from their landings, or lifters and throwers that are exerting force on their pelvic floor through intra-abdominal pressure. Athletes tend to be motivated by progression, and sometimes they require that extra resistance in order to get them strong enough to counteract the forces that they're experiencing in their sport. And the same would go for women after childbirth that are active, your runners, your CrossFitters, recreational athletes. Having that resistance of using the vaginal weights after you've done your therapeutic activities of building up strength during regular sit to stand, other transitional movements, is really helpful to get them back to their sport. I saw one particular athlete that had undergone a VBAC, and she had a pretty decent prolapse, and after about a month using weights, she was able to return to running with a really stable pelvic floor, and she ended up being a Boston qualifying marathoner. So really good results there. Another population is the postpartum population that is a little bit further out. So sometimes we think of our postpartum patients as being the women that come in at 6 months or 6 weeks or 3 months, and we are treating them for more acute postpartum impairments, maybe pelvic girdle weakness or pain, incontinence, prolapse, things like that. But sometimes they don't make it in that window of time, or we're seeing them a little bit further out in the 9-month to 12-month window, and they're still healing, they're still mending from postpartum related impairments, but they're still really tired and they're still really busy, and they may have a pretty full schedule. And there's some evidence to suggest that 80 to 100 Kegels per day are what's required to get people dry. And a mom in that window of time may not be able to get all of that done, even though she's well intended, really motivated. It can be hard to remember and hard to set aside all the other things happening in her life to do that. So with the vaginal weights, there's a few different training paradigms that you can use that will allow her to multitask and get it done while still getting her other duties done. And that goes for any busy person that wants to get better, but they are just not carving out the time to do their exercises. So looking at the purpose of the strengthening when it's endurance, you can have them place the weight for 15 minutes while they're showering or doing light household chores or getting ready in the morning. And so she's able to do that and get her things done and be done with it. She can also place the weight and do fewer sets with higher resistance to get more effect there. Coaching them to take it slow and to start with maybe 1 or 2 sets in one day to see how they respond is usually a good idea. General muscle soreness can be expected when you're starting a new strength program. As with anything in physical therapy, some soreness can come about, but of course we don't want to tip them over to the point where they're too uncomfortable. So it's usually trial and error, and usually getting then to a 3 out of 5 first before introducing the weights is a good idea. And the last population that I really see great benefit of using the weights for is the patients that can't come to formal physical therapy. Maybe they come to evaluation and we find out that their deductible is really high, or maybe they've utilized all of their physical therapy allotment on their insurance for the year already and they can't afford it, or maybe they live really far away. For me, the area that I practice, I have some patients that are driving upwards of 2 hours one way to come and see me, and that's a lot, and they're not able to come once a week or even every other week sometimes, just due to the general nature of their schedule and the fact that they live so far away. And I know a lot of pelvic therapists live in areas like that where you might be the only one for a really large radius. So using the weights where they can progress themselves in a safe manner in between visits, or if they can't come to visits at all, is really beneficial. And the nice thing about the Intimate Rose vaginal weights is they come with instructions. So if you're not able to see them at all, if they call in and talk to you on the phone and just they're not able to come, that's a good direction to go. The customer service for Intimate Rose is really outstanding. They are really committed to making sure that the customer gets access to what they need in terms of if there's a problem with the product. And the other thing that's really impressive is if a patient self-refers or a customer self-refers to the product through the internet and they write into customer service with an issue, Intimate Rose will go on to either the APTA women's section on women's health or Herman and Wallace database and find a pelvic therapist in their area according to their zip code and connect them with that therapist. And they're actually developing a pelvic health network right now as well that will have a list of pelvic health therapists that want to be on that list as well. So the company really recognizes the role in pelvic physical therapists in helping their customers. So it goes both ways in terms of making sure that people get what they need. So for more information, or to join the Pelvic Health Network, or to receive a set, of the vaginal weights for your clinic, visit intimaterose.com.